Good evening, good morning, everybody, and a great welcome to all of you. From good morning to good evening, 9 a.m. to 5 p.m., we will be going through a marathon race of some of the favorite topics, favorite questions, hot stock for the examiner for the today's exam. So, I hope you all like this pattern. First, you need to be challenged in order to pay attention. So that is the reason first we give you around 30 MCQs, challenge your beautiful mind. Extempore, you will answer some question, some answer, and after that we have a discussion, and always keep a 200 pages notebook so that whatever that you felt that you need to do a revision, you can make a note. Always personal notes is the best notes and a great companion in the tomorrow's exam. Dipendra, Vivek, and many more who are all online. Hope you are all ready for that long journey today. Now, doctor, ear, anatomy of ear is one of the favorite high-yield topics for the examiner. Keep punching the answers one more round. Infection of the CNS, it spreads through the inner ear through the cochlear aqueduct. Good to see Roshan Yadav. So we have semicircular canals, you all know. This is the utricle. Then you have an endolymphatic sac. And this is the saccule, scala tympani, scala media inside it. Then this is the scala vestibuli. And here you have the CSF. Now the examiner's question, how does the CSF basically spread? It is through this cochlear aqueduct it will be passing. This is the cochlear aqueduct which enables the CSF to pass. That is what you need to remember, where the middle ear infections can spread into the brain and can lead to development of meningitis. One of the very common causes is the otitis media, is what you should remember. So what is cochlear aqueduct, doctor? The scala tympani is connected to the CSF through this cochlear aqueduct. It's a connection between scala tympani and the CSF. And endolymphatic duct is basically formed by what? It is the union of saccule and utricle. So you have the utricle here, you have the saccule here. The both ducts unite and they form the endolymphatic sac, whose dilatation lead to the development of Meniere's disease. Hydrops of endolymphatic sac in Meniere's disease. Then in case of Meniere's, how do you treat it? You do a shunt operation in order to let the drainage of that hydropic endolymphatic sac in case of the Meniere's disease is what you should remember. So here you can see Hirtel's fissure. So what is meant by Hirtel's fissure? Let's talk about it. It is also called tympanomeningeal hiatus, is the name which is being given for the Hirtel's fissure. Now, it is an embryonic remnant. This Hirtel fissure is an embryonic remnant and it connects the CSF space to the middle ear, just anterior and posterior to the round window. So, normally this Hirtel's fissure get obliterated. That's the point you need to appreciate.